Hi, my name is Joe, and this is Susan. In this segment, we show you how simple and quick it is to find the health insurance plan that's right for you on Marketplace America. First, we would like to introduce you to Marketplace America.
Marketplace America gives you access to marketplace health insurance plans on the Federal Exchange. Our site is fully integrated with the Federal Marketplace, which allows you to access live insurance quotes in less than 1 minute. And once you find a plan you like, you can enroll in about 7 minutes.
Let's go ahead and look at how quick and easy it is to find the health insurance plan that's right for you.
This is our Marketplace America software. Remember, it's fully integrated with the Federal Marketplace. So the first step in finding your plan is to redo the 1 minute estimate.
Okay, so let's go ahead and redo that 1 minute estimate. And to do that, all you really need is your zip code to get started. And we're going to use the same one we did for the estimator. And remember, we went over these boxes in some detail. Box 1, 2, and really box 3 that's going to pop up here in just a second in our 1 minute estimate video. But Susan, let's go ahead and redo the estimate real quick, okay? So we can go ahead and get to finding the plan that's right for you. Because there's different steps you need to look at when you're talking about finding the right plan for you. Now, who needs coverage? Susan, in our first example, we had an age of what?
We had a 45-year-old male. He was a non-smoker.
Okay. And again, if he smoked, you'd check this box, or if you had to add another person, you could add a box. But this box is really done, and this person needs coverage. Now, box 2, what do we got, Susan?
Box 2 is where we're going to get lower prices. We said he was a single individual, so his household size is 1.
Okay. If it was more than that, I could use this drop down and come down, but we're going to leave it at size 1. And what was our estimated annual income?
Estimated annual income was $19,000.
Okay, and as soon as I put that in, box 3 pops up, and this is what I like to call the magic box or the subsidy box. This actually lowers the cost of health insurance for you. And that's why you can actually see plans down here with a 0 monthly out of pocket. It doesn't mean it's free, it's just fully subsidized. But Susan, we're talking about finding the right plan for the customer. And we've actually quoted it with steps 1, 2, and 3. Now if I come down the left hand side, I can sort it. And that's going to help me find it. I can sort it by lowest monthly premium.
And that's what we recommend.
Or lowest deductible or worst case scenario. Well, the one we really like is which one, Susan?
It's lowest monthly payment.
Absolutely, and that's going to be your default there. All right, then if you're looking for a particular insurance company, you can click on these boxes and just look at the insurance companies, plans from that insurance company. And then you've got providers, okay, and there's different classifications of providers. And if we're not going to go into a lot of detail on this, but if you hover over this, it actually gives you the definition, and you can look at that. Okay, and then you got metal levels. Again, if you hover over this, you can find it. But we can tell you most of the time people are going to either pick the bronze or the silver, and most of the time that's based on the price of the plan. Susan, let's go ahead and look at one of the plans and show them all the information that's actually provided in a box right here.
Okay, first you have at the top you have the title of the plan and the name of the insurance company.
All right, so this one that we've got here is a bronze 15 copay POS Upstate. You know, that might sound confusing to people, but right underneath it says who the insurance company is. It says Coventry Healthcare. But what I really like in this title is what?
Right, it is the copay plan.
Absolutely, it's a copay plan. Now, what else have I got here?
Okay, next I'm going to be looking at the big blue number. That's the monthly premium that you pay.
All right, so that's the monthly premium that you pay out of pocket. In this case, it's actually 0. And there are plans that you can actually get where you don't have to pay anything out of pocket. Then what do we got, Susan?
We've got the deductible amount per person.
Okay. And then over here, we've actually got copay amounts. Now, when we're talking about finding a plan, I know most people want to go look at the big blue number first. That's the amount they're going to have to pay out of pocket. But what I really encourage you to look at first and foremost is your copays. After you figure out a plan that you can afford, go ahead and look at your copays, because you want to find a plan that's got copays. That's critical.
That's right.
Now, Susan, there's a couple other features in here. Notice that this says this is a bronze plan. That's just identifying the metal level. And then we've got a compare box. We'll go over that in just a second. Or we got a details box. If I click on the details, it's going to give me more information about this plan. What have I got down here?
Right. It's got the out-of-pocket limit. That's your worst-case scenario.
All right. Worst-case scenario, chances are, unless you go in the hospital, probably not going to happen.
That's right.
Okay. Now, if you're looking for certain doctors or certain medication, you've actually got a link right here to the doctors and the medications that this plan covers. Okay. Also over here, we've got some more copay information. What's that?
Right. It was telling us the amount that you pay for certain prescription drugs.
Okay, whether it's generic, brand, or specialty, the more specialized, the more expensive it is. But it's, again, critical to have a co-payment, even on drugs. All right, now, Susan, that's one of the plans. Now, let's say I wanted to compare the lowest cost bronze plan to the lowest cost silver plan. So I'm going to come here and I'm going to click on compare, and then I want to go down and I want to find my first silver plan right here, and I want to compare these two plans. I click on compare, and once I pick those two plans, I can come back up here to the top and pick compare, and I'll compare the lowest cost bronze plan to the lowest cost silver plan and see how that kind of compares. And what are they going to see most of the time when they compare the bronze to the silver?
Well, the first thing, if we're looking at the big blue number, the silver plan does have a higher monthly premium. It's $46 per month. The next thing is that they also generally have lower deductibles and lower out-of-pocket maximums.
All right, well, time out. Let's look at this deductible, because right here it says under the bronze it says $5,500. What's our deductible under the silver?
It's actually zero.
Absolutely. It's not quite showing up right, but there is no deductible, and that's huge. And a lot of people don't understand they can actually get plans with no deductible. Again, that's huge. Now, how about our out-of-pocket max?
The out-of-pocket max on the silver plan has been reduced from $6,350 down to a maximum of $2,250.
Okay, and that's really almost worst-case scenario. That's
right.
Huge. And both of these plans are POS plans, and both of them have copays. The bronze plans copays, notice, are a little bit more higher than the silver plans. Okay, but this just gives you a great comparison side by side all the way down. And once you find the plan that you're ready to enroll in, all you got to do is what, Susan?
Right, just click that enroll button, you'll be ready to go.
All right, and we'll talk about how to actually enroll in a plan in our next segment.
Now that's how simple and easy it is to find the plan that's right for you on Marketplace America.
If you missed our videos on getting a live estimate in 1 minute or less, or enrolling in your plan, make sure and check those videos out if you feel you need more information. Otherwise, you're ready to choose the plan that's right for you and enroll in your Marketplace health insurance plan.